I'm Berks County Commissioner Christian Leinbach, and I want to welcome you to our Commissioners Board meeting for January the 14th of 2021. We're broadcasting live today on BCTV, MS Teams live event, Facebook Live, and YouTube. At this time, I'll recognize my Executive Assistant, Mary Buer.
Public comment will be accepted through the Q&A function. Please include your first name, last name, and municipality. Any comments without a name and municipality will not be considered. Each citizen can submit one comment. Comment length is dictated by limitations of the platform being used: Teams Q&A, Facebook, YouTube. The meeting comment period is limited to 30 minutes in total. Please be concise. Comments will be read during the meeting and should not be considered to be interactive dialogue with the commissioners. Any commissioner response to public comment will be done at the discretion of the commissioners.
Thank you, Mary. As always, we'll begin this morning's meeting with a moment of silence, followed by a pledge to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. As we've been doing for many weeks, this week being no exception, I want to recognize Brian Gottschall. He's the director of the Berks County Department of Emergency Services, and he is the lead on the Berks County COVID-19 leadership team. Today's going to be giving two parts to the report: the main report on data and statistics for COVID-19 here in Berks County, but that is also going to be followed by an update on where we stand with vaccinations here in the Commonwealth, but more specifically here in Berks County. With that, Brian Gottschall. You're muted, Brian.
I was just checking to see if you were on top of things. Excellent work. As you noted, we are going to have a two-parter here. First of all, our data report, and then our follow-up on vaccinations. As always, we begin with the Pennsylvania Early Warning Dashboard from last Friday, the most current version of that dashboard published prior to the commissioners' meeting on a Thursday. We do see some downward trends and indicators in the community, but some upward or horizontally remaining trends with respect to hospitalizations and things that are indicative of folks with illness. And this is understandable. I mean, even though our case count is going down from what was a bit of a peak that we had, now those people that were positive are becoming sick and ending up being hospitalized. And as we're going to talk about in a bit, we certainly hope not, but potentially succumbing to the disease. Our look at our 14-day case count and our 7-day testing count. We do see testing coming back up. And as I said, our cases have come over a little bit of a peak and went down a little bit. Again, seeing an upward trend. We never know where this is going to end up. Some of these peaks and valleys change very abruptly. But the good news is that we have rounded over the top of the peak that we saw a few weeks ago following the Thanksgiving holiday. Will we see another corresponding peak that is reference with respect to the Christmas holiday? We don't know that yet, but we hope not. Our first test positivity numbers, as our case numbers, have rounded over a high peak and are on a little bit of a downswing, which is great news. I had mentioned just a couple weeks ago that back when we were in the almost 20s, I was thinking we were at extreme numbers, and quite honestly, did not imagine that we would see first test positivity at 50%. Our new slide that we added a few weeks ago, tracking COVID deaths in Berks County, we are seeing an alarming upswing in the slope of this curve. And what I'm talking about here is in the right-hand side of the chart, when we see kind of how vertical that slope is getting, how rapidly day to day are the number of deaths climbing. We, as you will note, are back almost where we were in parts of the spring. And that is, of course, very worrisome because while the disease is terrible in so many ways, of course, it is the folks who are succumbing to it that are obviously most impacted and that we're most concerned about. Our hospitals continue to see an uptick in activity related to COVID, not enormous numbers from week to week, as you can see here, but definitely continuing to climb. Keep in mind that we were in the 150 range or so, or even 130 range back during the summer lull. So significant impacts to our local hospitals with respect to individuals with known or suspected COVID. We always do our county comparison where we take a look at how we stand in relationship to other counties in the state, and remember that the circled values that we have interest in are based on per capita, so it takes out the question of, well, do we have more people than them? Do they have more people than us? We would think that we would be at 9 in all of these columns based on our population. We see that our testing continues to be at about the same place it was, our cases continue to be at about the same place they were, and our deaths per capita are at about the same place they were. Some good information, or I should say some good statistics, some bad statistic, but in all cases, relative only to other counties. And as I keep saying, because we are one big community, us being better than somebody else really isn't good for anybody. This is a new slide that I wanted to take a look at, and this references kind of what I said about where we saw the cases peak over, but we still are seeing hospitalizations increase. And that got me thinking that the other thing I wanted to look at was death lag. How far after we see cases going up or coming down do we see the number of deaths moving in a corresponding way? And I want to take a couple seconds here and point out some things about this slide because it can be confusing. This is what's called a dual axis evaluation. So on the left-hand side, we see the scale for the number of daily cases over a 14-day smooth period. And that's relative to the blue line that goes across the chart. And then on top of that, kind of superimposed on it, we see a black line. And that black line references the axis to the right, which is the number of deaths over a 14-day smooth period. And obviously, it looks like we have more deaths than we have cases. Well, that's not really the truth because the axes are different. So the highest peak on the slide in the black for deaths is about 155 because you need to look to the right side of the chart. The highest peak for cases on the right-hand side of the chart over here in the blue line is about 4,750 cases in a 14-day smooth period. So you really can't compare the lines directly. What you want to look at is how the lines move in relation to each other. And what you can see when we go back to the spring, although our cases peaked around the middle of April, we see that our death peaks related to the spring really were around the beginning of June. So this indicates the time delay, if you will, between cases being identified and then folks ultimately succumbing to the disease. And there is some reasonable consistency to this. As we saw the cases start to decline in the spring, we then saw a subsequent decline in deaths matching that a number of weeks later. And then when we move over here to the fall, in the blue line, we see the cases starting to come up again. And in the black line, a few weeks later, we see the deaths starting to come up again. And I bring this to your attention because I'm very worried that our deaths, as terrible as they are right now, have not reached the worst they're going to be, even if our case count doesn't go up again. And to say it very succinctly and perhaps very harshly, there is still dying to be done from the last peak of cases that we saw in the December, January timeframe. So please be attentive to that. Don't think that because our cases have peaked over, we're out of the woods. As I've said a number of times during these calls, what we do today really doesn't get us any benefit today, or I guess technically get us any harm today. If we act irresponsibly today and contract the disease, or we act responsibly and avoid the disease, we as a community don't really feel the benefit or pain of that for weeks from the time that the action took place. What we do today makes a difference for what we're going to see happening in February and March, and we all really need to keep our heads around that concept and help that to drive our responsible activity. At that point, I'm going to pause and just ask if the commissioners have any questions about the data report before I move into the vaccination discussion.
Brian, one area that I would raise, and that is one thing to keep in mind about deaths in the spring. The most vulnerable, and I've read a number of pieces on this, in many cases, the most at risk many of them may have already succumbed to the disease. And there are some saying there aren't as many people out there at risk. So while the deaths, there is an absolute correlation between case count and deaths in weeks later, we may not see the same correlation that our chart shows in the spring. If you look at how relatively low the case count was in the spring compared to dramatically higher case count here in late 2020 and early 2021. It's also important to mention there's dramatically more testing going on now than was even available in the spring. So just a caveat, not saying the chart's wrong. I think the chart's important, it's valid, but just wanted to point that out.
No, I think that's a great point, Commissioner. I would agree that the correlation that I'm looking at is simply the movement of deaths as compared to the movement of cases. I would agree 100% that we can't look at, we can't say if and these are just made up numbers to show the ratio. We can't say that 1,000 deaths in the spring, 1,000 cases identified in the spring resulted in 100 deaths in the spring, and therefore 5,000 cases identified in the fall will result in 500 deaths identified in the fall. You're 100% correct, and not only what you said, but also the apparent change in the disease itself, that the disease perhaps, while it appears to be more contagious, if you will, more able to be easily spread, it appears as though it's not causing the severity of disease that it caused in the spring. And I'm not a public health expert. I'm certainly not a physician. I can only consume the information that I'm seeing from reliable sources that lead us to those conclusions. So you're 100% correct. I don't believe that we can look at any comparison between what happened in the spring and what's happening in the fall directly, but I do believe that we can look at the movement of the trend line in the same way. More cases is going to equal more deaths. Maybe not as many per case, but more unquestionably. All right. With that, we'll move back over to the slide presentation and talk about some of the vaccination concepts here. And the first thing I wanted to do is cover for the public, kind of at a high level, the vaccination concept of operations from the federal government all the way down. And the federal government has dictated the rules for how this is kind of supposed to work. So we've all heard about Operation Warp Speed. This was the federal program that was intended to get vaccinations produced and moving. And the feds have said that they're going to supply the vaccine and the supplies to administer the vaccine under Operation Warp Speed. And they're going to manage this process. I shouldn't say manage. They're going to guide this process utilizing the CDC, the Center for Disease Control's Advisory Committee on Immunization Practices, or the ACIP, which we see commonly talked about in documents related to this. And this is, in essence, the federal oversight that dictates to the lower levels of government how this is all supposed to work. And one of the first things that they dictated is that they're going to provide the vaccine, but the process is going to be state managed. And in Pennsylvania, that means that it is managed by the Pennsylvania Department of Health, who is the lead agency for public health in Pennsylvania. While some counties, and Commissioner Weinbach, I think you correct me about this number all the time, I want to say it's 7 counties and a total of 11 health departments.
It depends how you count Delaware County. It's six or 7. It's 6 without Delaware County.
Okay, so, and what he's referencing there is that Delaware County has engaged in an agreement with Chester County to kind of have the Chester County Health Department act as the Delaware County Health Department, for lack of a better term. So with respect to those entities, they are not autonomous. They still answer to the Department of Health under this process, with one notable exception, and that is the city of Philadelphia. The federal government has elected that in the largest jurisdictions in our nation, those entities will be treated effectively like states directly under the federal government. So in Pennsylvania, we kind of have to think of it as we have Pennsylvania and then we have Philadelphia. And Philadelphia has the same level of autonomy that the state itself does with respect to the federal government. So again, the point of that is to say that DOH is still guiding the activities of the health departments in the counties that have them. And those health departments have to perform their operations under the guidance from DOH. They're not autonomous. So in Pennsylvania, they've created a structure for this, which they've referred to as the PA COVID-19 Vaccination Task Force. This is a number of officials, primarily state government, although there is also engagement from the Allegheny County Health Department on this team. And this committee, in essence, develops the rules of engagement for vaccination in Pennsylvania. And they publish that through the PA COVID, what is currently called the PA COVID Interim Vaccination Plan. And I believe the term interim is intended to recognize that this is continuously changing. Right now, the version of the plan is version 4. All of the information that I'm presenting here is publicly available on the State Department of Health's website by simply Googling PA COVID vaccine, and it will take you to the DOH webpage, where there's then multiple link outs to various pieces of information about COVID vaccine in Pennsylvania. In addition, another important document that governs this is what is called the Vaccine Provider Agreement. And this is literally a legal contract that has to be signed between the provider of vaccine and the Centers for Disease Control. And the signatories to the contract, if you will, are the CDC and the provider of the vaccine, but the document recognizes that this is done in collaboration with the state authority, in this case, PA Department of Health, and compels the vaccine provider in certain ways. One important thing to realize is that the only eligible recipient to sign this agreement, the only people that can get vaccine, are licensed medical entities. Not county governments, not local governments, not a large corporation that has an interest in providing this service. To get vaccine, you must be a licensed healthcare provider in Pennsylvania. So we want to talk about a little bit how this changed from what the norms were and how the plans were written for many, many years. And up until approximately late October, there was still discussion about using what is called the SNS pod concept. And SNS is Strategic National Stockpile. This is a concept, if you will, a series of plans that have been in place for literally well over a decade, probably close to 2 decades, to be very honest with you, that speaks to how what is generally referred to as community prophylaxis will be handled. And whether this is the administration of a vaccine or if it would be the handing out of oral medicines after an anthrax attack or something like that, there are plans that speak to a pod or point of dispensing. And, very generically, this is some of what we see in the news, where we see a public facility, an arena or a place like that turned into a place where people go in order to get the prophylaxis that's being offered. And through late October, we were working on that type of a concept in Berks County because we were told that that was going to be the beginning of this process. Closed pods, not open to the general public, open to certain categories of people, which I'll talk about in just a little bit, and where they were going to come and have to complete the necessary paperwork and registration within state systems to receive vaccine. this is not a simple undertaking. You need to have logistical capabilities at these locations. You need to have healthcare professionals who are capable of administering the vaccine. And any way you look at it, this was going to be, as I keep saying, a community as a whole approach to the vaccination process. However, at about the end of October, there was a shift, and DOH advised that let me step back a moment. Even when we were talking about these closed pods, DOH was saying that as vaccine became more readily available, the primary methodology of administration to the general public was going to be through their normal healthcare providers and the commercial pharmacy system. At about the end of October, DOH pulled that back and said that closed pods were not going to be the first methodology of delivery, that instead the health professionals and pharmacy operations were going to be the primary methodology of delivery right out of the gates, and that the recognition of these closed pods, or in some cases open pods, was going to be happening much later in the process as kind of a mop-up concept, where we understand that there are certain folks in our community, particularly those who are financially distressed or otherwise underserved, don't have good access to the medical provider system as it normally stands. And in an effort to make sure that we capture those people, it was recognized that we may have to open up these community points of dispensing as walk-in opportunities for those folks to be able to access vaccine. But this front-end concept was taken off of the table. Another significant change to the norm is that usually we would see that anytime there's material coming down from the federal or state government, people who get that material have to agree that they're going to use it, they're going to provide it in a way that is coordinated and in concert with the government. There is no obligation that we can find that any of these providers that receive vaccine work with each other or work with local county government. They must work under the direction of the state government and under the direction of the federal government as it's laid out in their plans, but there's no further obligation that they work together. Now, clearly that doesn't mean that we don't think they ought to be working together and that we want to bring all of these people together and get them, in essence, singing from the same sheet of music. But out of the gates, that obligation does not exist. And once they have the vaccine, they are free to do with it what they believe is the right thing to do in concert with the rules being set forth by the federal and state government. So I want to talk a little bit about the statistics of where we are at the moment. And this slide shows vaccine that has been received in Berks up through the 13th, or yesterday. And I've broken this out by color groupings. I've organized it by the name of the recipient and then broken it out by color groupings for the 5 weeks of vaccine distribution to date to show when those, recipients received that vaccine in each week. To date, 18,000 doses of vaccine have been received by providers in Berks County, according to the data that the state is making available to us. We have asked them to provide this data in a forward-looking concept so that as new recipients are coming on board, we can try to reach out to them and get them in the fold and get them kind of working in a working group with other providers. But that data is not yet available. We only get this data in a retrospective fashion of who has already gotten it. It's worth pointing out that of those 18,000 doses received, 11,700 of them have been received by our 2 local hospitals and our Pfizer vaccine, the more difficult to handle ultra cold vaccine, and 6,300 doses are the Moderna vaccine, the still challenging but more easy to handle, not ultra cold vaccine. The next statistic we want to look at is vaccine administrations in Berks County. And we see Berks circled there, second from the bottom of the list as it's organized. It is important to recognize that these numbers, again coming from DOH, are based on the address of the recipient. So someone who went to a facility in another county to receive vaccine but lives in Berks County is in essence credited to Berks County. And it's very difficult to go back and forth between these statistics because we have to recognize that we talk about Berks County as a geographical location. We talk about Berks County as a geopolitical structure, the government of Berks County. And then we also reference Berks County hospitals, which of course are not part of Berks County. They're just located within Berks County. So you have to be careful as you move back and forth between these numbers to not believe that 18,000 vaccines received in Berks County means that 18,000 vaccines will go to Berks County residents, just like we don't want to believe that the approximately 9,000 Berks County residents who received vaccine got that vaccine in a Berks County location. They may have gone elsewhere to get that.
Brian, could you elaborate on the out-of-state 25,000 number?
I cannot. I honestly have no idea what that means, Commissioner. It came from the DOH. I wanted to make sure to put the statistic in there because it is so large. But the only thing that I can suggest is that it represents people who came to Pennsylvania and received vaccine in Pennsylvania despite having an address that is physically located in another state. There are no obligations to prove, again, just like our Berks County hospitals, they don't say, well, you're from Chester County, you can't have vaccine, or you're from Lehigh County. No different than our residents are going to other counties offering vaccine at the appropriate tiers to receive vaccine. One important caveat to this is we don't know if this includes FPP recipients. And many people may not know what FPP is, but just keep that in the back of your head for a moment. We are going to address that in a future slide. We are unclear whether these numbers include FPP recipients. So on the state vaccine website, they also provide a very nice GIS-based mapping tool that shows the locations of vaccine providers and whether the vaccine providers have received vaccine or have not received vaccine based on a green or red pushpin. And the concept here is ultimately to allow the public to understand where the locations are that have vaccine in the particular geography that they're interested in. These are the only pushpins on the map currently that are within Berks County. That's why I didn't show the whole county. I zoomed in to get as much detail as I could to show the pins that existed. I will point out, as I show in the lower right-hand corner of the slide here, this is not 100% in sync with the distribution data, and again, we don't know why. Said very simply, if we go back 2 slides, there are facilities on this slide that, according to the DOH data, have received vaccine, yet are not represented on the maps on this pushpin. So again, I believe that DOH is working as quickly as they can in a very complicated process to try to get all the information out there, but we have to accept that it is not 100% in sync when you compare it across various ways of looking at it. So the next concept that we get to then is how the phases or tiering that we keep hearing about is supposed to work. And I would encourage everybody to go to the state DOH website and look at the vaccine plan as a whole. It's a lengthy document with a lot of detail. And I, of course, am trying to take some very granular information about the phases and tiering in that document and simplify it down to just a couple slides here for our discussion this morning. So please start with what I'm presenting and go back and look at that document and draw your own conclusions and make your own interpretations. So the first phase, one other thing I should mention before I go on, is that as the plan has changed through the 4 iterations that have existed prior to or including the one that is out there today, these phases have changed also. And I believe that they're going to continue changing based on information that we're hearing. So what I'm telling you is current as of me writing this presentation last night. Phase 1 is when we recognize that there is highly limited vaccine available nationwide, and that is where we are right now. There is not all the vaccine that we need for everybody to get it. And during this phase 1 process, DOH has broken it down into what were originally 2 and are now 3 tiers for administration. Tier 1 is long-term care facilities administered through the FPP. The FPP is the Federal Pharmacy Partnership. This is a program put in place directly by the federal government with major pharmacy chains to get vaccine into our long-term care facilities. And we're talking about skilled nursing facilities or assisted living facilities, what we all commonly refer to as nursing homes, but also other long-term residential facilities like drug rehabilitation facilities, like alcohol recovery facilities, like group homes. These are all part of what are looked at as long-term care facilities. And this is also outside of the auspices of the states. These are direct contracts from the federal government to these pharmacy providers, and the two pharmacy providers that are being used are Walgreens and CVS. And then those pharmacy providers are provided lists from the federal government of facilities that are to be reached out to and scheduled. There was an article in the paper just the other day about how Berks is getting their vaccine the 28th of January, I believe is the first date. And I will mention that the original date of administration was the first week of March. And when we found that out, we were aghast. We reached out to DOH. DOH was aghast. And they then reached out to the federal partners, and subsequently we were able to get that date pulled back into the end of January. We have asked DOH to provide us with the information about all of the facilities in Berks County, which pharmacy is servicing them, and when they're anticipated to be serviced, so that we can try to anticipate if there are needs that are going to happen at those facilities, because somebody's got to be first and somebody's got to be last. I mean, that's just reality, and nobody ever wants to be last, but clearly not everybody can be vaccinated simultaneously. But for those that are going to be towards the back of the list, that may indicate the need for additional capabilities like push-in of state resources related to infection control and assessment, or PPE that will be needed for a longer period of time that may be less needed at facilities that are vaccinated early. We're having a very difficult time getting our arms around that data from DOH. So again, Tier 1A long-term care facilities through the Federal Pharmacy Partnership, and healthcare personnel, I apologize this was cut off, but with emphasis on those with close contact to COVID patients. So again, we can't vaccinate every healthcare person first. That somebody's got to be first, somebody's got to be last. So the recipients are asked to do what they call sub-tier those people in ways that address what they do and who they interact with, of course, the emphasis being on those with close contact with COVID. Beyond Tier 1A is Tier 1B. And there are three ways that folks kind of fall into Tier 1B, and you could fall into more than one of these sub-reasonings. The first one is by occupation, frontline essential workers with close proximity to the public. Commissioners, you guys would not be Tier 1B because you don't have close contact with the public. You're generally working remotely, even though you're essential public workers. You're not those with close proximity to the public. You would fall into 1C, which I'm going to talk about in a bit. The second reason that you might fall into 1B is due to some condition. And the first condition would be age 75 and over. And again, the ask is that if there is not adequate vaccine available to give it to everybody 75 and over that would want it, it would first go to those with underlying health conditions. And then the third reason would be by what I refer to as living condition. For example, they live in a congregate care setting that is not otherwise considered a long-term care facility, or they're receiving home or community-based services. So those folks would all encompass Tier 1B. And the original discussion from DOH is that this would be done in a serial process. Now, we understand that somebody in 1A might get overlooked, or they may not have wanted vaccine, and 3 months later, they then decide they do want it. So it's not like everybody in Tier 1A would get vaccine before moving to 1B, but DOH was very emphatic that this was a serial process where we effectively would be involved in vaccinating 1A before we move to 1B, and 1B before we move to 1C. I'll mention that has changed somewhat, but that is what is laid out in the plan, and that is the mindset. The next tier of phase 1 is tier 1C. Again, a couple ways that you fall into this grouping. The first one is by occupation. These are other essential workers that don't necessarily have close public contact, but who are recognized in a fairly complex federal document that I won't go into detail about, but it's a critical infrastructure and key asset report that recognizes certain sectors of our society, like food processing and energy and those kind of things, as being critical to the functioning of our society. They would be the first grouping of tier 1C. And then the second one is, again, by condition. Here we're looking at age 65 and over, or age 16 to 64 with high-risk conditions. Again, to the extent that there is an adequate vaccine for everyone in this sub-tier, then we would be asking, we are expecting the providers to look at people with multiple conditions or underlying health conditions in addition to their age first. And then finally, after there is ample vaccine, or what they call expanded supply of vaccine available nationally, then we would move to phase 2, which is everybody else that doesn't fall into phase 1. I will point out that if you begin to think about this, phase 1 is not a small group of people. There are a lot of people that fall into one of those categories under phase 1. And that, of course, is part of the challenge. As I said, somebody's going to be first, somebody's going to be last, and there are going to be a lot of people in between. So I'm going to pause there, commissioners, and ask if you have any questions about tiering, just because that is so important and so complex.
Let me share a question that is from the public, but it's specific to your report, so I think it's appropriate to address it now. And the individual doesn't have their residence here, so I'm not even going to read the name, but the question is a worthwhile question. Will you have an online registration for employers, individuals to sign up for the vaccine? And that probably will relate to what you found out yesterday from the Commonwealth plans.
Yep, that's a great question, Commissioner. I'm just going to ask that we put it on the back burner because I do address it in the presentation.
Okay, great.
Okay, so moving on from the tiering and phases of tiering, we just want to look at what DOH says about where the state is at today. And the state says that we are in phase 1A. In the opinion of DOH, vaccine should be being administered to 1A individuals. And there is no published timeline to move to 1B, but the Secretary of Health has stated that there will be more information about that the week of January 18th, which is next week, based on when this presentation is being given live. We want to talk about the known current conditions in Berks County, and this is current as of 21:45 hours last night when I typed on this slide. I can't tell you that this hasn't changed in the last 5 minutes or 5 hours. We are doing our best to stay on top of this, but it is a constantly moving target. There are 5 providers that we know are publicly reaching out and providing vaccine in Berks County in various ways. Beyond that, we know that there are other recipients of vaccine, some of whom have secured vaccine for the administration to their own healthcare personnel, which is perfectly allowable, and some of whom are making vaccine available to other groups that they feel an obligation to handling, but not doing it in a fully open public way. And again, there's nothing wrong with that. For example, a doctor's office that received vaccine may reach out to their local emergency providers or their local EMS agency or other doctors' offices that are near them that they work with readily and offer that vaccine under the current plan of administration to those individuals. The 5 that I'm showing you here on the screen are the ones that we know, as a matter of fact, are publicly advertising the availability of vaccine. They've done a press release, they put it on their website, something like that. And that is Penn State St. Joe's, who are presently doing Tier 1A administration, including unaffiliated healthcare providers. So even if you don't have any relationship as a doctor or a dentist or anybody else in the community that's delivering healthcare services, you can reach out to St. Joe's and be scheduled to receive vaccine at their location. Tower Health, Reading Hospital, same thing. They're doing Tier 1A, but they have also, as of yesterday, begun doing a limited Tier 1B administration. That included fire and law enforcement. And we know this because they provided us that information and asked us to help get that information out into the community, very specifically to fire and law. Now, I will say that we have been told anecdotally by folks in other Tier 1B groups, like crisis counselors and group home type facilities, that they have been successful in securing vaccine through Tower, but that is not presently part of their public release as we understand it. The Berks Community Health Center, who our department has worked very closely with, they assisted us in getting vaccine out to our EMS community as early as possible. And because they're a very small operation, their mission, if you will, is to serve the underserved community the underserved community in the community, the underserved portion of our community. They aren't really big. They don't have a lot of outside looking resources like telemedicine and the ability to do online scheduling and those kind of things. So we kind of help them by handling some of those logistics and providing them lists of individuals that they then were able to ultimately vaccinate. I know for certain from talking to their leadership that they're also getting outreach from dialysis clinics and other smaller healthcare providers in the community that are looking to get vaccine for their personnel. And as a result of that, they're able to work to schedule individuals. So that's why I said that they're doing this Tier 1A by direct engagement. They're really, while they want to help and they want to do everything they can, they're really not set up to have individuals contact them. So they're hoping to hear from groups of people represented by that group's management team at like a healthcare facility who are willing to help bring together the demographic information and provide it to them so that they can help. And then St. Luke's and Lehigh Valley Health Network, who both have facilities in and around Berks County. I shouldn't say that. I think Lehigh Valley has facilities in Berks County. I don't believe St. Luke's has any in the county, but definitely around the county.
St. Luke's does. They're up in Hamburg. Urgent.
Oh, that's right. They have the urgent care on 61 now. I did forget about that, a fairly new facility. But they also have opened a hospital just north of the Berks County line in I guess technically in Orwigsburg along 61 there. So both of these very large health operations are offering vaccine at a number of their facilities and are offering it to Tier 1A and Tier 1B. Again, anecdotally, we know that teachers and other folks who are in that essential worker with public contact category are able to go to these locations and receive vaccine. So this merits the question of, well, what's this idiot talking about? He just told us that everybody has to follow the state rules, and that the state says that we're at Tier 1A, and now he's telling us about people that are doing limited Tier 1B and full Tier 1B. And the answer is everybody's trying to do their best. I don't think the state's going to come out and write tickets to people who are doing what they think is in the best interest of their community. And I don't think that any of our healthcare partners are doing anything wrong by getting the vaccine out in the way that they're trying to get it out. I can't give you a satisfying answer for why the state says we're still at 1A, yet we have multiple healthcare providers in the Berks County area doing 1B. I think that the best answer that I can give for the public is we should all do our best to take advantage of whatever opportunity is available in our community and pursue vaccine in the fastest, most efficient way that we can get it from where we can get it, not get wrapped around the axle of why there's a difference from one place to the other. Because the goal of everybody is to get past these tiers and get vaccine into everybody that wants it and that we can get it into. I think there's also a lot of discussion and consternation in the community about why we're giving vaccine to police officers, but not the elderly, or teachers, but not those with pre-existing conditions. And I personally struggle with some of those concerns, but I'm not a public health expert. I have a lot of opinions, and people that know me or will say that Brian is an opinionated guy. But I also think that I'm smart enough to know that my opinion is just that, an opinion. And there are people with expertise who are making these decisions at higher levels of government who have a greater knowledge and greater understanding of what's going on. And to some extent, we have to trust that, yes, they will make mistakes, but they're trying to do the right thing and they're trying to do the best thing. So this brings us to what is on the horizon, and we have heard definitively, we know for sure, there's a CCAP conference call with the Secretary of Health today at noon that I know that all the commissioners are intending to be on. I, of course, will be on it, and we'll be hearing the most up-to-date information available from the Secretary of Health at that time. We know that
CCAP, a lot of people.
I'm sorry, Commissioner. Yes, CCAP is the County Commissioners Association of Pennsylvania. It's basically the professional organizing organization that county commissioners in Pennsylvania belong to, that helps to kind of lobby for the counties and also to disseminate information to the county level and advocate on behalf of county government in Pennsylvania, whether it's with the state or the feds. Anything else you want to say about that, Commissioner? You're obviously a lot more tuned in than me. Okay. The other thing that we know for sure is that 2 nights ago, there was communication from the federal government to the states, and I say state, it wasn't just the PA, it was to all the states, directing that the states begin vaccinating those folks that are 1B by condition immediately. So folks 65 and older and those with pre-existing conditions are now being effectively moved to the front of the line. And Brian Gottschall, this is one of those things that I've had consternation about. Why are we giving vaccine to otherwise healthy people in critical roles, but not giving it to the people most likely to succumb or have serious impacts from the illness? It looks like the feds are realigning their strategies and have pushed that information out to the state. The Secretary of Health announced this in a town hall that I participated in that was put on by the Democratic caucus of the state Senate. And she said at that time, like that town hall was at noon, she had a meeting at 1 o'clock yesterday with state officials to begin talking about how the state's going to accommodate this. And again, they have promised that they will have guidance about how this is going to open up by the week of 1/18, next week again from this live presentation. They have also advised us that there will be a statewide vaccine registry in 1 to 2 weeks. This is not a substitute for, the term registry is a little bit confusing. So this is not going to be how you schedule for vaccine. It's not going to be how you say, I want to come Tuesday at 2 p.m. It's where you're going to put your information into a database and say that you want vaccine. And this is the reason why you qualify for vaccine in a certain tier. And then the state is going to take that and match you up with a vaccine provider so that then you can actually be scheduled with that provider. So I hope I explained that well, and I hope it makes sense. But the state has acknowledged that that is necessary and is saying that that's going to come out in 1 to 2 weeks. We don't know whether there's going to be validation involved in that. And a lot of this is on the honor system. And of course, everybody hopes that the public as a whole will do the right thing and not lie about their affiliation or lie about having a pre-existing medical condition to get moved to the front of the line. There are counties that I'm aware of that are actively participating in the review of information that is being submitted and in essence, calling people out and saying, well, you don't qualify and we're not supporting that you should receive vaccine. We don't understand whether the state is going to do that or not, or whether they're just going to do this as an administrative efficiency to get information onto the providers. And then the last thing is kind of what I would call our predictions. And I want to be very emphatic about that. This is based on the best information we have available and are trying to read the tea leaves what we think is going to happen here. We believe that DOH is going to expand the current mandate to vaccinate beyond Tier 1A. Remember that I said that there is nothing that obligates vaccine providers to do anything with the vaccine other than use it internally within their own organization. So a doctor's office that asked for enough vaccine to vaccinate just their people had the right to do that. That changed effective on January 7th. Anyone who receives vaccine after January 7th is now mandated by order of the Secretary of Health to provide a minimum of 10% of the vaccine that they receive out to other unaffiliated healthcare providers, other Tier 1A people in the community. We think that the Department of Health is going to further expand that beyond Tier 1A and put obligations on people receiving vaccine to also vaccinate other tiers of people within the community. We also, and I know this is controversial and people aren't going to like to hear this, but again, we want to be 100% open with what we perceive to be the scenarios. We believe that there's actually going to be a slowing of vaccine administration in the next couple weeks due to the need to get second doses out. And this is one of the complexities of this process that really was not anticipated in any planning that I've ever been part of developing or education that I've received from other levels of government about prophylaxis planning. We've never openly talked about the two-dose concept. We believed that we were going to have to kind of touch people, get them whatever they needed, their bag of antibiotics or their injection, and then move along to the next person. This concept of having to bring everybody back for a second dose, unless we dramatically grow the number of people who are giving vaccine, there are only X number of people who can stick X number of needles and X number of arms. If 4 weeks after the first vaccines were given, all those same people have to be seen again, that means that those people administering vaccine can't see new people to get their first dose at that same time. So it's a simple math problem that if we aren't growing the number of vaccination sites, the number of people receiving vaccine from the state, and the number of people doing those injections, you have to accept that there's going to be a slowdown as we start to get into the second dose administrations. We also believe that the federal government is going to allocate additional funding to the states to support this effort. There is what is commonly accepted to be very limited funding available at the moment, and I think that the states are actively lobbying for this and that they're going to start to see more money, and that's going to open up the doors then for the states to engage other means of administration, such as contracts with commercial pharmacies to become part of this process, or even contracting with healthcare systems to manage this process in certain counties or areas of the state. We also hope that there will be additional vaccines that receive the FDA emergency use authorization that are approved for single dose administration, which will make the process, of course, much easier. And we believe that most people will ultimately access vaccine, as DOH has said, through their physicians or their normal means of securing healthcare and commercial pharmacies. In essence, the same way that they go about getting their annual flu shot. The most important prediction that we want to make, because we want to be very honest with people and we want to control expectations, is that there will be people getting vaccine administered into the second half of 2021. Everybody wants it today. Not everybody's going to get it today. Not everybody's going to get it tomorrow, and not everybody's going to get it next month. That is a reality of the complexity of the process that is being dealt with here, and we would ask people, while we understand they may be unhappy, we understand that they have a right to voice that displeasure, but doing so at the vaccine providers, tying up their call-in lines or their email boxes as they're trying to do the best they can, is not really helping the situation. Everybody that's involved is doing what they can, and distracting them from that primary mission is not helpful to anybody, including you, the person that wants to get the vaccine. So that's the end of the report that I have to offer, commissioners. Again, it's certainly not all good news. It's probably not even 100% thorough news. But I believe that it's the best we can offer at this moment in time.
So if you can just stay there, Brian, another question that came up, and it actually relates back to the COVID impact on hospitals I'd like to deal with it right now. This is from Melvia Ahmed. Why I'm missing. Good morning. How well are our local hospitals handling the volume of patients they now have?
I think that the answer is they're handling the volume. They're giving people treatment. They're not giving people treatment as fast as they'd like to. We know that the wait times in ERs are very long. We know that the hospital staff is very beat up. They're really working very hard. The management teams of the hospitals have told us, even in the form of the mid-action document, that they've had attrition of staff members due to stress and the workload. But they are incredible community partners, and they're stepping up and doing everything that they can do. What they're asking the public to do is to help them and do everything that they can to slow the spread of the disease so that the impacts on those hospitals is not becoming more exacerbated. I think, to be very dramatic, no one is being turned away. No one is being told you can't get health care here because we're overwhelmed. But the only reason that's not happening is because of the incredible dedication of those teams of people at the hospitals that are working incredibly hard to make sure that they can still provide the necessary services in the community.
And I think you should note, you and your department, since the beginning, back in early February, have had regular communication with Tower Health Reading Hospital and Penn State St. Joe's. So this is not a matter of where they're doing their thing, we're doing our thing. We are working together.
Yeah, commissioners, and just to be clear, I know you know this, but for the benefit of the public, we actually work with those facilities every week. Long before pandemic.
Right.
They're involved in working groups that we have. We have points of contact at the hospitals and their emergency management teams that we talk to. We communicate with them about things as simple as major vehicle accidents that are going to result in lots of casualties coming to a facility, up to community planning and handling of radiologically contaminated patients. There's many different programs that we work with our local hospitals on and have continuous communication with them well outside of COVID.
So I suspect this presentation will be available on our website for those who can't join us on a meeting like this.
Yes, we can post a link to the YouTube link right to our Do Your Part website and also countyofberks.com. So Stephanie, if you can work on doing that, and I would suggest, if it is possible, we edit the video so it's just, we separate out the COVID-19 data report and the vaccination. So somebody that just wants to watch the vaccination can watch that. If they want the COVID update, they can watch that. If you have questions, we can talk about the technicalities of doing that, but make it easy for people to access.
It helps all of us when we get the calls and the emails. We can refer them to that. We can show them the links so they can decide which one they want to look at or both.
Yeah. The caution is the data is correct as of, was it 2100 hours last evening?
I have to put a disclaimer on it before anybody even watches it. Would probably be a good thing. A disclaimer before you even scroll through the pages.
Yeah.
Commissioner Rivera.
Yeah, I have a question for Brian. Brian, if someone is in the 1A or 1B category, you said there's certain locations doing the vaccination for 1A and 1B. What should these people in these categories be doing? Should they call St. Luke? Should they call Lehigh Valley? What are their next steps?
That is a difficult answer, Commissioner, because each facility has a different process. St. Luke's and St. Joe's have a telephone number that they have publicized, and you can go to their respective websites to get that information. Whereas Tower and Lehigh Valley, although you can reach out to them by phone, they're encouraging people to fill out the questionnaire and register through their respective healthcare portal applications, which is MyChart through Tower Health and My LVHN through Lehigh Valley. So kind of an emphasis on the web-based or app-based approach at Tower and Lehigh Valley, and a telephone-based approach at St. Joe's and St. Luke's.
Okay, so someone can just contact them directly to set up the appointment to go.
Yes, again, someone who is appropriate for the level of administration that they're making right now. Please don't overwhelm these phone lines or even their questionnaire process with false information because you want to reach out to them and ask questions or file a complaint about why you think you should be receiving vaccine now, but you're not. They're doing their best to follow the state protocols and what they think is best for the community and get the vaccine out in the way that they're dictating at the moment based on what I presented in the slideshow.
Okay, thank you.
Thank you very much, Brian. I'm amazed at times the kind of effort and detail you put into these reports. I talked to my colleagues yesterday. A year ago, you weren't doing any of this, and I honestly don't know where you and your team find the additional time, but you do a great job, and I don't know where the county of Berks would be without your leadership and your team in the COVID-19 pandemic. So thank you very much, Brian.
We appreciate that, Commissioner, and we appreciate the Commission's understanding that there are some things that are falling through the cracks that are perhaps less important because we're trying to focus on these things. But we recognize it's important, and everybody on the team is putting in a lot of hours to make sure that we're serving to the best extent that we can.
Thank you,
Absolutely.
Thank you.
We understand that. We're going to truncate our meeting, but before I do that, let's just start with the, are there any additions or corrections for the January 7th Commissioner meeting minutes? Hearing none, they will be accepted as presented. I do want to note we had one executive session since last Thursday, and that was on the 13th, dealing with personnel and security. I just looked, there's no public comments on the specific agenda item. And at this time, I'll recognize Commissioner Barnhart.
Yes, given the length of this meeting, I would ask that we approve the agenda as presented, and it's available on the county website for people that want to scroll through the agenda.
I will second that motion.
The motion has been made and seconded. Is there any discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Aye. Opposed? The motion is carried. With that, we're going to turn to Dennis Adams, our county controller with the county controller, yeah. Dennis Adams, our county treasurer with the treasurer's report. Dennis, maybe you could give the controller's report. We'll do that one week where we have you do one and Sandy do the treasurer, but we won't do it this week. Dennis. Dennis. Dennis must have been offended by what I said because I don't see him. We're going to go right to Sandy Graffius with the controller's report. Sandy?
And I'm sorry, I don't have the treasury report for you.
That's okay.
I don't know what happened to Denny. Okay.
I'm here.
Oh,
Okay, we'll come back to you, Denny.
I just couldn't get off of mute.
Okay.
Okay, our total cash disbursements was $6,388,742.73. That's it. Go, Denny.
Thank you. Dennis Adams, County Treasurer.
Good morning.
Good morning.
Opening balance today is $167,680,157.82. The balance to clear is $6,101,857.72, leaving us with a balance today of $161,658,300.10.
Thank you very much, Dennis. At this time, we'll recognize our Chief Administrative Officer, Ron Seaman. Ron?
Just like to congratulate Brian on the excellent job he did with the presentation for the general public on the state of vaccines and their availability and so forth. And to remind everybody in the listening audience of the words that the commissioners opened the last week's meeting with, indicating their feelings about violence not being the way to move within our country as we go into the inauguration this upcoming week. Remember that civility is the rule. Civility is the way we have to move forward. Thank you.
Thank you, Ron. And with that, we will move to commissioners' reports, and I'm going to recognize Commissioner Kevin Barnhart.
Thank you, Commissioner Leinbach, and welcome everyone who joined us this morning. I have 3 items to cover. I'd like to cover our update from Cook County Wellness, our contact tracing firm. And if anyone there would like to have this written report, I can certainly email it out to you. It's very extensive, but I will hit the high notes. They presently have 24 contact tracers working, additional hire of part-time tracers and community volunteers. There has been confirmed that the NED system is overwhelmed in managing a huge amount of data. The system is being shut down almost weekly, often for hours at a time, mostly on weekends, as they perform upgrades and add memory so that the system can keep up with the data. This is a critical since NEDS is that what actually feeds CTMS. From November 5th to January 13th, there were 3,349 contacts. The cumulative number of 3,349 actually had 811 contacts refused, so our percentage of refusals is 24%. One of the highlights back in June when we hired Cook County Wellness to handle this contact tracing for us, we had budgeted $1 million for contact tracing, and thus far to date, we have exhausted $71,368, which is a tribute to Cook County Wellness, as well as the volunteer support, which would have added an additional $45,771. We'd have been in excess of $117,000. So for me, this is praise and a shout out to the volunteers who have stepped forward in our community to also support Cook County Wellness with contact tracing. Last but not least, total from the beginning, from June 8th, there would have been over 6,200 contacts. One thing I'd like to share is we get information on potential large exposures. And from the beginning of the pandemic, we heard some anecdotal evidence that, well, this happens in densely populated areas. This happens where there's poverty. It really, for me, boils down to behavior. I'm going to call out some areas that there are large exposures: Kempton, Wilson, Ole, Twin Valley, Daniel Boone, Kutztown, and the Reading School District. This is not a Reading-centric problem. This is obviously a county, state, national, and international problem. It's not just concentrated in specific areas. To me, it boils down to behavior and how you handle yourself when you're out in the public. Very timely was an editorial in today's Reading Eagle. Opioid crisis hasn't gone anywhere. That is very true here in Berks County. Our number has again exceeded 100 deaths from overdoses, almost overwhelmingly fentanyl-laced deaths with whatever other chemicals and drugs that were ingested into the system. Our Opioids Coalition continues to do the work, sosberks.com, and we now have our most recent magazine available online, the Response Magazine. It's a dynamic magazine with lots of information on where the support is in the community for people who need treatment and recovery. It can be found at www.sosberks.com. Under click the information tab and top and click Response Magazine. In the coming weeks, we hope to have a SOS Berks update on one of our media events. We think it's very timely to talk about things, not just the pandemic. We know that's the #1 issue, but also to recognize that there are issues that continue to happen in our community. And last but not least, I know there is a fair amount of discussion out there about a county health department and why Berks County doesn't have one. I would also, as I did with Cook County Wellness's report, if you would like to see a presentation that was done in our August CCAP annual conference, it will explain to you the mechanics and the fundamentals of establishing a county health department. I'd be more than happy to share that with people. It's about an hour-long presentation. I have said from the beginning, I would certainly keep an open mind to the concept of a county health department. But then again, it takes no less than 2 years to set one up. This is not like setting up a MASH unit in 3 days. And there is significant cost and upstart. I've heard numbers that it's only $2. It is well in excess of $4 to $6 million, which would be about $15 a person. And you can't cherry pick what you want to do. When you sign on and have a county health department approved, you can't pick and choose what you want to work on. There's a multitude of things that come with the responsibility of having a county health department. Again, I believe I'm a fairly open-minded person, but I think in the midst of a pandemic, I don't know how you stand up a county health department. Now, as we move forward, is that a discussion that should certainly be taken by this Board of Commissioners? I have no concern about that. Again, please contact my office, either by phone or by email if you want the Cook County Wellness Report or the report from CCAP. How do you start up a county health department? Thank you.
Thank you very much, Commissioner Barnhart. We'll turn now to Commissioner Michael Rivera.
Yes, thank you, Commissioner Leinbach. I just have a few things. First, I want to start by thanking Brian and his team for all the work that they've been doing at DES. The information that he provided today was excellent. It answered a lot of questions that I've been receiving from the public. It answered some questions that I had as well. So I appreciate the work and the time and effort that Brian has put into this presentation and keeping us informed and the Berks County residents as well as to what's going on in reference to COVID and the vaccination. So thank you. Just want to remind everyone, we are through the holidays, but as you saw in the numbers, COVID is still around. It's not going anywhere, at least for the foreseeable future, near future. So please, let's everyone still remain vigilant. Let's do what we can to help stop the spread. I know a lot of us have COVID fatigue, where we're tired of the mask, we're tired of the social distancing, but we need to keep it up. We need to make sure that we're protecting ourselves, that we're protecting our families and our loved ones as well. Also want to share that on Tuesday, Commissioner Leinbach and I had the opportunity to attend the Alvernia College Town groundbreaking ceremony here right on Penn Street. It was a great opportunity. They had a slideshow as to what the building is going to look like. Commissioner Leinbach, as the chair, was able to share some words with the people there, as well as other people that were there. And then afterwards, we went downstairs and there was a ceremony of breaking down or starting to tear down one of the walls down in the basement with sledgehammers, indicating that that project is moving forward. It's a great opportunity. It's not only for students, but there will be an incubator there as well, which will help pair students with businesses, which will help new businesses start as well. So it's a great opportunity for students and for the business community as well, and for Downtown Ready. So we're really excited about what's going on there, looking forward to the grand opening. They're looking at having a ribbon cutting to be able to start in August. That is the deadline. So hopefully everything will continue to move smoothly there, because it is a great addition to downtown. And with that College Town, there are other things that are happening downtown as well, which we're really excited about, to see that the city is continuing to move forward and to grow economically. One other thing I want to share is that we are still working on the rental assistance program that I spoke about last week. That is something, the paperwork was submitted already, so it's something that the county will be doing. And as we have more information on that, on guidelines and where to apply and so forth, we will be sharing that. That's all I have. Commissioner Leinbach, back to you.
Thank you very much, Commissioner Rivera and Commissioner Barnhart. Just a note, I did have my regular meeting with the Berks County Redevelopment Authority virtually earlier this week. And we're very excited about the new federal dollars that are being made available for rental assistance here in Berks County. It appears it's going to be right around $12 million. And the Berks County Redevelopment Authority is working out the details right now, but that should be a major help to people that legitimately need the help. There will be a process that applicants need to go through to justify that they really have the need, but that is significant. It was not dollars that we were anticipating. One other item, this coming Monday is a day set aside to honor Martin Luther King Jr. I'm old enough to remember when Martin Luther King was shot. And in honor of him, I'd like to share a handful of powerful, but I believe timely quotes from Reverend Martin Luther King Jr. The first one: rarely do we find men who willingly engage in hard, solid thinking. There's an almost universal quest for easy answers and half-baked solutions. Nothing pains some people more than having to think. Let no man pull you so low as to hate him. The limitations of riots, moral questions aside, is that they cannot win and their participants know it. Hence, rioting is not revolutionary, but reactionary, because it invites defeat. It involves an emotional catharsis, but it must be followed by a sense of futility. Nonviolence is absolute commitment to the way of love. Love is not emotional bash. It is not empty sentimentalism. It is the active outpouring of one's whole being into the being of another. And then finally, there comes a time when one must take a position that is neither safe nor politic nor popular, but he must take it because his conscience tells him it is right. I'm sure, as I know, that there are a lot of other great quotes, but I hope in light of the times we are in, that all of us will consider the core message of these quotes. And just so you know, as I read these quotes, I don't think of you, I think of myself and how I can better apply those and live out those kinds of principles that Martin Luther King so strongly advocated for in each of these quotes. Thank you, and with that, we will move to any comments from our row officers. Hearing none, I will recognize my executive assistant, Mary Buer, to read those comments not already read prior. I think there were two of the comments that I read prior as part of Brian Gottschall's report.
Thank you. Crystal Kowalski, why I'm missing. Good morning, commissioners. In the interest of working together to create a more just and safe community, I would like to address ways to reduce the jail population at this time when our county is seeing 300 plus new COVID cases a day. Working to reduce jail admissions can significantly reduce the jail population in a short period of time. Here are 5 steps proposed by the Prison Policy Initiative that can be taken by various stakeholders. 1, police can reduce the number of arrests for petty offenses. 2, prosecutors can refuse to prosecute low-level offenses. They can dismiss charges when appropriate and refer people to social services as an alternative to incarceration. 3, judges can release people on their own recognizance. Judges can stop issuing bench warrants and refuse to jail anyone for unpaid fines and fees. 4, jail administrators can refuse to admit people accused of technical probation or parole violations. 5, state and local legislators can expand the list of non-jailable offenses. During this time of pandemic, we can reduce both the spread of COVID and the harm inflicted by mass criminalization and mass incarceration. We will achieve this when the people elected to positions of power use their discretionary power to interact with people in a less punitive way. This is possible. In fact, it is currently practiced in affluent, predominantly white suburbs. The news today tells us a man who invaded the US Capitol last week wearing a sweatshirt glorifying a Nazi concentration camp was arrested and released on his own recognizance. Let's change the system. Thank you, Crystal Kowalski. Jane Palmer, why I'm missing. The evidence is clear that counties with a health department are better able to handle the COVID crisis, including testing, contact tracing, and vaccine distribution. Neither the Reading Police nor your emergency department were satisfied with county response. And I can assure you the thousands sickened, the tens of thousands out of work, and the untold numbers of people mourning the dead, are at least as unhappy. Meanwhile, the Reading Hospital itself is close to breaking from the strain. Doctors and nurses are leaving in droves. Patients routinely wait 8 to 10 hours just to be seen in the emergency department. People are dying unattended in the hallways, and they're running out of critical medications. It is time for the commissioners to take appropriate responsibility for the health of our community. This is a public health issue, not a private one, and it must be met with a public response on par with the seriousness of the crisis, namely the establishment of a Berks County Public Health Department. Yes, it will cost, but estimates put it at $2 a person a year, less than a cup of coffee, and your inaction has already cost us dearly. Please let the people of Berks County know as soon as possible when you will establish a county health department. David Del Negro, West Reading. Commissioners, I come in today to ask that you give thought again to the future development of a county health department when the county is on more solid footing economically. Berks is growing and will need this infrastructure for whatever or whenever the next major health issue occurs in the future. Local control is a conservative principle and proactive public health a progressive principle. And I believe there is an opportunity for a bipartisan major accomplishment. I also want to thank Mr. Leinbach for his statement on January 7th after the DC riots. It was clear, unequivocal, and demonstrated great leadership. Thank you for your time, David Del Negro. Jess Royer, Spring Township. Good morning, Commissioners. In my role as a reference librarian, I often assist patrons with general technological difficulties. Recently, I helped a patron who asked that I pass along her frustration regarding the difficulty of access and the costs associated with the technology that is free to use for most of the world, video calling. She had been told that she could potentially speak with an inmate via video for 25 cents per minute, but the website said she had been told to use wasn't functioning. I went on the county website to both the inmate telephones and inmate commissary page, which lists a service called Connect Network. But unfortunately, the website www.connectwork.com was also not available based on the link posted on the county website. There are plenty of free services available, most of which include the feature to record or monitor calls that are not with an attorney. The PA Department of Corrections has made video calls available for free to inmates, and I would encourage Berks County to follow suit. Thank you. Louise Grimm, why I'm missing. Good morning, Commissioners. Before I address you, I would like to thank Mr. Gottschall for his thorough, transparent, weekly explanation of what is going on in our county regarding COVID. His work was made more difficult by the deadly rampage of this constantly evolving virus and the necessary changes to respond to it more effectively. It is so important for people to be able to understand the situation as it evolves and how to best mitigate it. He does an excellent job of sorting things out for us. All we need to do is follow his directions. We hear in the newspaper about nursing homes and prisons being overwhelmed by COVID-19. And we know the numbers of positives and deaths are at an all-time high. However, we seldom, if ever, hear about the Family Detention Center, a congregate facility that is at great risk of infection, as all congregate facilities now are. Will the people detained in these facilities receive the vaccine along with people in other congregate facilities? How many people remain in the facility since the ICE deportations, absent any asylum hearings? How often are residents and workers tested? When was the last time everyone was tested? Has anyone living or working in the facility been found positive? When will Ms. Sadler be reporting back on this facility, as her last report many weeks ago was very helpful to the many of us who are very concerned about the innocent adults and children held in the Berks County congregate facility? Would really appreciate answers to my questions, which have been ignored in the past. Thanks for all you do in your stand against the January 6th insurrection at the Capitol by right-wing extremists, and for standing by our election results and the election workers. Thank you, Commissioner Leimbach, especially for your last quote. Anthony Tucci, Birdsboro. No question on behalf of the Berks County EMS agencies. We would like to thank the commissioners for all of their assistance with PPE purchases. As the leader of the Berks EMS Joint COVID Task Force, we cannot thank them enough. Berks County should be the example to other counties to assist the emergency service providers. Again, thank you. And that concludes the comments in the Q&A session.
Thank you very much. We'll close comments at this time. I'm going to recognize Brian Gottschall. He's going to address an additional vaccination question that came up.
Thank you again, Commissioners. Oh, sorry about that. Have my camera off. Thank you again, Commissioners. I wanted to just address a portion of Ms. Grimm's question about vaccine at the immigration facility. I certainly can't answer all of her questions. Much of that is well outside of my scope of knowledge or responsibility. But with respect to vaccine, I just wanted to make everyone aware that we are working closely with the management team at the Immigration and Family Shelter. We are trying to understand the situation. We've looked at documentation from the feds about what federal facilities and what federal entities are accessing vaccine directly. And we've also been in touch with local sources, in specific the Berks Community Health Center, to try to gauge their willingness to come to the facility to ensure that we make vaccine available to the residents who are staying there at this time, should they choose to get the vaccine. And there are many legal complexities around this, as I'm sure you can imagine, given the status of those individuals. And we want to make sure that, number one, we're doing the right thing with our responsibilities to the federal government and how we're providing health care for those folks, because their health care normally does come through the federal government, not through the county department. And therefore, we want to make sure that we're not overstepping our bounds, but we are committed to also making sure that those folks are not forgotten about and are taken care of with vaccine at the time appropriate for their condition and living situation relative to the tiering that I talked about in our meeting this morning. So I don't have a definitive answer as to when or how, but the process is well underway and being looked at very specifically.
Thank you very much, Brian. Any other comments?
Just want to respond.
Barnhart.
Thank you. I want to respond to Crystal Kowalski. Thank you for your listing of potential ways to move people out of the jail system. I will take your comments back to our CJAB, Criminal Justice Advisory Board Steering Committee, as well as general membership meeting. But I would say item 4, where the warden could refuse to take technical parole violators and parole violators, that's pretty complex for a warden to refuse to take inmates who have been sentenced to jail. That gets a little more complicated than I have time to discuss here on the call. And Jess Royer, if you would call into our office and give us details on who the inmate was that this Danelle Blake was trying to call, we'd certainly try to track this down. I was able to call the warden during this call. They had one other complaint or concern this morning. They're trying to track down the issue with the phone system. So thank you.
Thank you very much, Commissioner. One other note I would make on Crystal's comment. One, the jail population is down, and it's down in part because the president judge, the district attorney have been working together to limit as much as we can the people that are being brought into the jail. On principle, I agree very much that jail should be for violent offenders and not for individuals that are there either on minor charges, minor non-violent charges, and or for unpaid fines, et cetera. However, and I think you know this, it's fairly complex. MDJs play a pretty significant role in this, and I know that the president judge has reached out to the MDJs and made them aware of the need to be very, very cautious. Additionally, our APO department, led by Bob Williams, we are now utilizing electronic monitoring to a greater degree than we ever have before. The county made the decision to hire additional staff so that this program could go forward. So we are committed, and the numbers are coming back down. We were up well over 800. I don't know, Commissioner Barnhart, but I think it was 7 something a couple of weeks ago.
Yeah, beginning of the year, we were at 950. We dropped to as low as 588, I believe, in April and May, and we are at about 740 this morning.
Yeah, absolutely. So we're going in the right direction. We just need to keep moving in the right direction. Any other comments?
Motion to adjourn.
Second.
The meeting is adjourned.